Missy McCallum from Dignity Medical Aesthetics. I'm going to talk to you a little bit about Botox today. It's what we get the most questions about. Botox is a brand name. It's been around since 2002 in terms of being FDA approved. And when it was first approved, it was for these frown lines up on the forehead. What happens is you get injected with this product. We use little tiny needles, and 7 to 10 days after injection, we see relaxation occur. When you relax a muscle, if it's a muscle that pushes down, then it pulls up. So while it is FDA approved mainly for the upper face, there are lots of places we use these products. Why am I saying these products? Because since then we have more. We've got Dysport, Xeomin, and Jeuveau. They're all FDA approved in the United States, and in Europe they have even more. Why do we pick one over another? In our practice, it just has to do with patient preference and what we've seen over time in terms of things that make our patients more satisfied with one product over another. Sometimes people actually get resistant to these products, and so that's another reason to carry other products. But here's the fun thing. There's other places you can use this stuff. You can inject crow's feet, and that helps with the lines we get when we smile. We're actually releasing the muscle that bears down like this, and so when you use it there, it lifts. And people like that brighter, open-eyed look. The forehead muscles sit right here, mainly the frontalis, and their job is to elevate our brows. When we inject the forehead, we can drop the brows. And on someone like me, you have to be really careful with that because I have a thicker forehead. So we might use a really low dose on me and a higher dose on someone else who has very thin skin over bone. They look beautiful with a lot of product up there. Where else can we use it? Downward pull of the mouth. These are called the DAOs, and they make us look like we're frowning when we're not. When we relax these muscles that pull down, it can pull up the corners of the mouth. You might have heard about the lip flip. That's going along the top of the lip. We can do it upper and lower. How does it work? Our lip is like a sphincter. It closes in. When you relax it, it opens up. What are the downsides? Well, with the lip flip, there are some. It might be hard to say the letters P and F for a couple of weeks, drink out of a straw, that sort of thing. For most people, it resolves. For the downward pull of the corners of the mouth, releasing that, usually just lifts up the corners of the mouth a little bit. But some people have had food pooling down there and other things like that. In the chin, some people have orange peel, especially when they do this. And when you do that, you see all that pebbling in there. 4 units of the products can be fantastic. Where else can we use it? Those bands that come up the neck, they're called platysmal bands. We've even treated people off-label for plantar fasciitis. We've treated a downward pull of the nose by lifting up here. We treat bunny lines. You know it's FDA approved for migraines. We don't actually do it for that, but a lot of our patients report that that helps with those kinds of headaches when they get cosmetic treatments. That's a few cool ways to use these products. If you come in for a consultation, we'll explain in your case what might be a good fit for you, the dosing, the cost. You pay per unit, so we always try to get you to achieve the best possible outcome with the fewest possible units. And one more thing, don't underdo this area. It's the one area we get the best results with full relaxation. If you don't get full relaxation, you don't get the best duration, and you don't get the best outcome. That's our tip for today. Thanks for checking in.